Okay, let's jump into the sources today. We're focusing on retained placenta, that postpartum condition in dogs and cats.
Right, it's something that happens right after they give birth. A bit uncommon, the sources say, but definitely important.
And our mission here is to sort of unpack what the materials say this actually is, how it might show up, and what the sources suggest for dealing with it.
Exactly. And what's really interesting right off the bat is how different the sources say it can be between dogs and cats.
Yeah, that species difference really stood out. So let's start with signs. Obviously, the animal has just given birth. That's the history.
That's the baseline, yes.
What's the main, visual clue the sources mention?
Well, the sources consistently point to persistent green lochia, that vaginal discharge after birth. Normally it changes, but here it stays green, and for longer than expected.
Okay, so that persistent green color is the big flag. And the sources also say feeling for a mass in the uterus isn't always helpful.
Not always reliable, no. And they also note you might see signs of metritis, a uterine infection happening at the same time.
Right, so infection can complicate things.
Definitely. Especially in dogs. The sources link retained placenta often with acute metritis. They also list specific risk factors for dogs.
Oh, yeah, like what?
Things like toy breeds seem more prone, having a really large litter size, and also difficult birth dystocia.
Okay, so certain situations make it more likely in dogs, but back to that species difference you mentioned. That sounds pretty key.
It really is, according to the material. So dogs usually pass placentas super quickly, like within 15 minutes of the pup, if they don't pass
Excuse
one.
me, get sick fast.
Yeah, they could develop that acute metritis pretty rapidly. But cats, the sources say they might hold on to a placenta for days and seem perfectly fine.
Wow, days without signs. That's a stark contrast.
It totally changes the urgency and how it looks, for the owner or the vet.
Okay, that difference is crucial. So if you suspect it based on, say, that green discharge, how do vets figure it out for sure? What about diagnosis and the sources?
Well, the approach described involves ruling other things out first, like postpartum metritis is a big one.
Uterine injection again.
Right. But if it's just retained placenta, uncomplicated, the cytology looking at the cells usually won't show signs of infection. Another thing to rule out is a retained fetus.
And imaging helps there.
Exactly. X-rays or ultrasound can tell you if it's a fetus or just tissue. The sources specifically highlight ultrasound.
What does the ultrasound show, according to them?
It might show what they call an echogenic mass inside the uterus, so it looks bright on the screen, but doesn't look like a developing puppy or kitten, just tissue.
Got it. Bright tissue, not a baby. You mentioned cytology, too, the cells. What specific findings do the sources talk about there?
Yeah, vaginal cytology is important. The sources list seeing parabasal epithelial cells, which are normal lining cells, some red blood cells, erythrocytes, and critically, these things called biliverdin clumps.
Biliverdin clumps.
Yeah, they're noted as breakdown products, basically related to that green placental tissue and discharge. Finding those is a strong clue.
So those clumps are like a microscopic sign pointing right at it.
Pretty much, yeah. And unless there's that secondary infection, standard blood work and urine tests are usually normal, according to the sources.
Okay.
Though they do mention sometimes, in tricky cases, surgery might actually be needed just to confirm the diagnosis, like opening the abdomen or the uterus itself.
Right, if the other tests aren't definitive. So once it is diagnosed, what are the treatment options outlined in the material?
If the animal seems okay otherwise, the sources suggest starting with just outpatient monitoring. Basically, the owner keeps a close eye on temperature, appetite, energy levels.
Watching for signs of getting sick, and if that's not enough, or if they're already showing signs.
Then medical options usually come first. Oxytocin is the main one mentioned. It's that hormone that makes the uterus contract.
To try and expel the tissue?
Exactly. The sources give specific dosages for dogs, 0.5 IU per kilogram intramuscularly, up to 5 IU total. Cats get 0.5 to 1 IU/IM. But they note it's generally only effective within about, say, 48 hours postpartum.
Okay, so there's a time window for oxytocin.
Yeah. And sometimes they mention giving IV calcium gluconate slowly before the oxytocin, but you have to monitor the heart really carefully for arrhythmias if you do that.
Good point about monitoring. Anything the sources say not to give.
Absolutely. A big warning is do not give progestational drugs. And of course, if metritis is present, that needs its own treatment plan alongside the retained placenta issue.
Treat the infection too. Makes sense. When does surgery come into play based on the sources?
Surgery is usually considered if the medical approach doesn't work, or especially if metritis develops or gets worse.
And what kind of surgery?
Well, in a very hysterectomy spay is curative, obviously, if the owner isn't planning on future breeding. That takes care of it
That's a
completely.
definitive fix.
Right. If they do want to preserve breeding potential, surgically removing just the placenta might be tried, but the sources kind of imply spaying is often the end result if medical treatment fails.
Okay. And what about the prognosis? How do things look afterwards, according to the sources?
For dogs that get that secondary acute metritis, the prognosis for just recovering from the illness with treatment is described as fair to good.
But what about future breeding?
That's where the metritis really matters. The sources say the prognosis for future reproduction is good if metritis doesn't happen, but only fair to poor if it does.
So that infection is really the key factor for future fertility, based on what you read. Okay, let's wrap up this deep dive.
Yeah, so the key takeaways from the sources seem to be: it's rare, dogs and cats present really differently, look for that persistent green discharge. Ultrasound and cytology with those biliverdin clumps are key for diagnosis.
And treatment involves monitoring maybe oxytocin within that early window, or surgery, especially if infection complicates things or future breeding isn't a goal. What this deep dive really highlights, looking at their sources, is how crucial those small details are. You know, the specific color of discharge, the timing after birth, those tiny clumps seen under a microscope. They aren't just abstract facts.
They're the actual clues.
Right. They're the critical observations that help you, as an owner or a vet, pinpoint this specific uncommon problem. It really makes you appreciate how much vital information can be hiding in plain sight after a birth if you just know what signs to look for.